Okay, now we're talking about chronic liver failure or cirrhosis. That is scarring of the liver. Liver cells are destroyed and become fibrotic. Blood and lymph node flow are impaired, and it usually affects patients 40 to 60 years old. There are 4 kinds. Alcoholic, most common type. Post-necrotic as a result of previous acute viral hepatitis. Liver is generally very small. Biliary results from chronic biliary obstruction and infection. That is more the rare type. Patients will have clay-colored stool and dark urine. Cardiac, follows severe right-sided heart failure, leads to necrosis of liver cells. Signs and symptoms. Fatigue is an early sign. Fatigue, dull heaviness in right upper quadrant of the abdomen, unexplained fever, slight weight loss, liver enlargement, feels like a firm, sharp edge. Weight loss is also an early sign. Right upper quadrant heaviness, unexplained fever, liver enlargement. Anorexia, indigestion, nausea, diarrhea, constipation. Other signs are GI disturbances such as anorexia, indigestion, the nausea, diarrhea, constipation. Constipation often leads to hemorrhoids, flatulence, dilated veins in the esophagus, which can cause esophageal varices. Hematological issues include easy bleeding, bruising, epistaxis, prominent abdominal veins. Hormone issues, they may have an excess of hormones because the liver can't metabolize the hormone. Other metabolism issues include affects the CNS, central nervous system, causes confusion and decreased level of consciousness. Jaundice is a late sign. Pruritus is a late sign. Jaundice is caused by elevated serum bilirubin levels. Generally, you have a clay-colored stool. Loss of liver function is a late sign. Other issues, they can't manufacture albumin. It causes decreased blood volume and edema. That leads to ascites. Increased bile salts into the skin causes intense pruritus, which is itching. Peripheral neuropathy, tingling or numbing in the extremities. Scalp body hair, deficient in vitamin B12, folic acid, and thiamine. These are just pictures of your pulmonary erythema. You'll see the red hands, the spider veins that you often see, especially in the abdominal area. This is just a picture of the later clinical manifestations. Changes in mental responsiveness and memory, jaundice, spider angiomas in the face, neck, and shoulders, esophageal varices, anemia, thrombocytopenia, coagulation disorders, ascites, collateral veins, visible on the abdominal wall, hepatomegaly, splenomegaly, pulmonary erythema, sexual characteristics and changes, hemorrhoids, edema, and peripheral neuropathy. Your diagnostic test. You check liver enzymes, bilirubin, urobilinogen, serum ammonia, PT, abdominal x-rays and examinations, of a GI series, liver scan, EGD, and a biopsy of the liver. Some of the complications: hepatic encephalopathy that can occur in any form of hepatic failure as a result of increased serum ammonia. Liver is failing and can't detoxify the ammonia. Ammonia is formed in the intestine by bacterial action on ingested proteins, can lead to hepatic coma. Signs and symptoms of impending coma are subtle, progressive, mental confusion, slurred speech, slight tremor of the hands. Closer to coma, lethargy, irritability, muscles twitching, hyperventilation. Portal hypertension occurs when the portal vein is obstructed by a tumor, clot, infection, or unknown cause. The resulting buildup of pressure, called portal hypertension. Blood backs up into the spleen and bypasses the liver. Complications of esophageal varices. You have ascites, is accumulation of fluid in the peritoneal cavity. It may be a result of the portal hypertension. Hepatorenal syndrome. It's renal failure, often following excessive diuresis, paracentesis without albumin infusion, or GI hemorrhage. Esophageal varices. Complication is bleeding. It can be very life-threatening. They're dilated, tortuous veins, usually found in the submucosa of lower esophagus and into the stomach. The hemorrhage from rupture is the most common single cause of death in a patient with cirrhosis. Portosystemic encephalopathy. Treatment is decrease protein in diet to 0 if possible. They're going to see changes in level of consciousness, progressive confusion, stupor, impaired thinking and judgment, neuromuscular disturbances, asterexis, the liver flap, hyperflexia. Treatment: decrease protein in the diet, give lactose and neomycin. Problems increased by increased protein, infection, hypovolemia, hypokalemia, and GI bleeding. Increased blood ammonia. This is just a picture of how the portal vein is, esophageal varices, spleen. It shows you a picture of a actual person with ascites, and it shows you how they're doing abdominal paracentesis. Markings on the item, this largest diameter. It's very, very, very important to always weigh these patients daily, measure their in and outs, and get a abdominal girth on them every day. There's treatment for ascites: diuretics, sodium restriction, albumin. This helps maintain blood volume and increases urinary output. Paracentesis, MD removes a few liters of fluid at a time. It's important for the nurse to record amount, color, fluid, the consistency, and send specimens to the lab. Usually, generally 2 to 3 liters. Need to indicate the color. Is there bleeding or infection present? Monitor the vital signs every 15 minutes after the procedure is done until the patient is stable. Check dressing for bleeding. Put patient in high Fowler's position. Apply sterile dressing afterwards. You may require peritoneal venous shunt of transjugular intrahepatic photosystemic shunt. Mouthful. Okay, so for esophageal varices, it just kind of gives you a picture of what it looks like. That is a very dangerous thing. People can bleed to death from this. The treatment is sclerotherapy. Solution placed in varices or veins causes varices to harden and close. Patient may have chest pain for several days. You wanna give pain control. If not relieved, call the MD. Surgical ligation of veins is top veins using endoscopic portacable shunt. Diverts blood to the vena cava or to the splenic vein. Stent is placed into right jugular vein through right atrium and into vena cava, then inserted between hepatic and portal veins. Let's see, Sidge taken Blakemore, esophageal gastric balloon. It applies direct pressure to bleeding veins in the esophagus, stomach, if ligation or sclerotherapy fail. What meds are vasoconstrictors, blood transfusions, and vitamin K. Proton